Perfect. Thank you so much. So welcome to Innovative Approaches by EDDs to address social determinants of health. As I said, if you can introduce yourselves in the chat, that would be great. Just a few things before we have our speakers move forward. I'm Melissa Levy. I'm the Wealth Creation Specialist at NATO. I focus on all things wealth creation, and this is no exception. And that's how you reach me. I'm happy to chat anytime about all things wealth creation. Just some housekeeping things. You can submit questions or comments in the chat box. There will be a recording of this webinar that will be made available on the NATO website. There will be a post-webinar survey. We hope you will do that after the webinar just to let us know how it was, what we could be doing better, any topics you might be interested in, us covering either through written pieces or through webinars or conference sessions. And that's my email in case you have any questions about the topic of this webinar or any other wealth creation kind of topics. That's pretty much it there. Yeah. As I said, this is the website for the Community of Practice, which is funded by the Economic Development Administration. And there's a disclaimer there about the statements, findings, conclusions, and recommendations don't necessarily reflect the views of the Economic Development Administration. We're about 3 weeks away from the annual training conference. So if you haven't registered and you want to be going, this now is the time. So there's a website for you. It's October 14th through the 17th in Salt Lake City. And I thought before we got started, we could just see who's here. Just a couple of polls. Where are you from? Just so we can get a sense of what region you're here from. Yeah. So we'll just take a minute to do that. Okay. Let's see what we've got. Not too many from my region. I should say I'm based in Vermont, just outside of Burlington, Vermont. And yeah, a couple of people from that region, a lot from Atlanta, not surprising, and Austin. Okay, wonderful. Well, thanks for doing that. And then I also have one more poll, just so we know what kind of organization you're calling in from. So we have economic development district, local government, state government, all of these things. So if you can just do that. I always like to have a sense of who's here, and I think it helps our speakers too, just to understand who they're speaking with. So not surprisingly, a lot of economic development districts. This is the Economic Development District Community of Practice, so great. Wonderful. So yes, almost 80% economic development districts, a few local governments, and a few nonprofits. Wonderful. Well, thanks for playing along. I think it's really helpful all around to understand who's here. So we'll take that down. Perfect. Well, I wanted to share, since we're talking about the social determinants of health, this is a piece that we just put out in the past few weeks. So feel free to take a look. Some of the stories, certainly Vicky's story is in here, and there are some others in here as well of how economic development districts are actually working on the social determinants of health. And I think, the point I guess I'd like to make today, and I will say it again, is that I think you're all working on this, and we just haven't used that language. So anyway, something to take a look at. But some things that you'll find in there are these are the kind of key categories of social determinants of health. So, what are they? So, you can see it's economic stability. And this is, I think, how the Department of Health and Human Services defines it. So, economic stability, education, social and community context, health and healthcare, and then neighborhood and built environment. And I actually think this really connects with the forms of wealth and wealth creation as well. You can find parallels here, like economic, like education is really intellectual and individual capital, and health and healthcare is clearly individual capital. Social and community context really connects to social capital. And the neighborhood and built environment really gets at built capital and also I think cultural capital and things like that. There are definitely some really interesting parallels, something that I'm going to start thinking about connecting with too. And then these are some of the ways that EDDs are addressing the social determinants of health. So, and I'm not going to read these, but you'll recognize them if you look at that document. So, probably the biggest way is incorporating it into the SEDS. Certainly workforce development and job creation, infrastructure, and then on and on through the things that EDDs already are doing, right? So fostering public-private partnerships, leveraging funds, and things like that. So one more poll question just about your experience with the social determinants of health, since that is the topic of the hour. Just trying to get a sense of, uh, oops, uh, not, not that one. Yep, there we go. So in which areas of social determinants does your organization work? And probably should have left that. Yeah, and I would guess most is economic stability, but we'll see what else. I'm guessing, there's different levels of how people and organizations are interacting with the social determinants. So, um, great. Good. We'll just take another minute. I think this will help our speakers as well understand where people are coming from. Great. All right. I think we can close it and see what we see. Looks like mostly a lot of economic stability and a lot of um, neighborhood and built environment, which makes sense to me. Some social and community context, a little education, health and healthcare, and some other, which I'll be interested to see what that is about. Great. Well, thank you so much for doing these polls. I do think it helps understand kind of where people are starting at in this discussion. Today's presenters, we have Vicki Jennings from Land of Sky Regional Commission, Shaq Powers from Region 9 Economic Development District, and then Rochelle Howe from Upper Explorer Land RPC. I'm really excited to have all of them. They're all going to be sharing about fairly different pieces of the social determinants of health. And I'm going to pass it along to Vicki. Vicki, can you introduce yourself and then we'll get going?
Absolutely. First of all, I need to say I need a new picture, apparently. My hair has not been that color in a long time. But thank you so much, Melissa, for having us today. I think this is going to be a great discussion. As Melissa said, I'm Vicki Jennings. I'm the Director of Strategic Initiatives at Land of Sky Regional Council in Asheville, North Carolina. We serve four counties, and we have the four counties and 16 municipalities in our region that we serve. So primarily our organization is working with housing and transportation in terms of the social determinants. So just as a little bit of a background about the program in North Carolina, the state was granted an 1115 Medicaid waiver. If you're not familiar with that, it's a federal waiver where the Center for Medicaid Services allows the state to use the money in a different way. Several years ago, like back before COVID, there was this push to take our Medicaid services in North Carolina to managed care. So, as part of that managed care program, the Healthy Opportunities pilot was born. And what that pilot program does, um, it gives people the Medicaid participants the ability to have services paid for from their Medicaid fund that are not medical needs. So we're talking about food security, we're talking about transportation, housing, and housing is a huge, broad term for a lot of different things that we can talk about in a few minutes. And then interpersonal violence and toxic stress, those were kind of grouped together. So in those four areas, the state was granted the ability to pay for those services for Medicaid participants. So if you go to the next slide, Melissa. So the whole point of the Healthy Opportunities pilot was to reduce the need for more costly clinical interventions, like on the screen there. Um, and by providing those services upstream, we can reduce the costs downstream, was kind of the whole point. And so, for an example, when we were talking about getting into this work, the example that we heard was, okay, so let's assume that you have a child who has asthma and lives in a home where there is toxic mold. If we can help that family, reduce that mold or get them into safer housing, then we can reduce the need for the little girl's health care later in life. So the whole point was to meet those social needs of, more sustainable housing, healthier food, transportation to and from medical appointments. We had people, and we still have people in our Medicaid system who are using 911 as their primary way to get to medical appointments. Well, we know that's not sustainable and it's incredibly expensive to the Medicaid system. So if we can pay for some transportation for that person to get to their medical appointments, then we can reduce medical costs. So that's the whole point of the Healthy Opportunities pilot. So then when the Medicaid waiver came down and we were allowed to do these kinds of services, there were three areas in the state, and that's on the next slide, Melissa. I think I'm getting ahead of myself. So you can go ahead and change to that next slide. So there were three areas in the state that they were awarded contracts to do these services. The purple area in Western North Carolina is where I'm located. And so that pilot region is 18 counties. It's incredibly rural. Buncombe County is the largest county in the area, and it's where the largest metropolitan area is in Asheville. And so the state allowed our entity to do 18 counties to serve for the pilot regions in those four areas. They put aside $650 million to do this work. And we being Land of Sky, were tasked with the opportunity to develop a transportation network through the 18 counties and to do some housing. So a little bit of background about us. Um, Land of Sky is home to the MPO, the Metropolitan Planning Organization, which does transportation. You're probably aware. So the MPO does transportation. We also do community transportation. We're the administrative entity for Buncombe County's community transportation. And we also hold the contract for Buncombe County for their non-emergency Medicaid transportation. So we already had this transportation network that we had built throughout Buncombe County. But now they were saying, hey, could we have those same resources in the 18 counties, which was a huge task for us. And so we started contacting community transportation services and throughout the counties, the other counties that we serve, and started putting in place cab companies, those kinds of things to develop this transportation network. The entity that got the contract for the Healthy Opportunities pilot paid for us to ramp up our staff. So we were able to add 3 full-time staff members to do this work, which helped with us economically, because we could not have done this without, money from the entity. The entity is Impact Health. It's a Dogwood Health Trust entity. It's a nonprofit arm of Dogwood Health Trust that they put in place to do this work. You can also see on the map, there's two other places, the Access East and then the community care of the Lower Cape Fear area. So there were those three pilot areas. Oh, so we started doing the transportation, and part of that transportation was to provide bus passes, which was a difficult task because there's only a couple of counties that actually have buses. And then we could, like I said, we put together cab companies and we could pay for transportation to and from non-medical sources. So if people needed transportation to go to take their kids to school, if they needed transportation to take their kids to daycare so they could work, if they needed transportation to go to a food bank, there were, numerous scenarios that we could pay for transportation, and Medicaid was reimbursing half of the federal rate. So right now the federal rate's 70 cents, so the rate would be 35 cents a mile. There were limits on that, and that creates some issues. The limits were only $300 a month. And so obviously we had to make sure that people understood that their $300 a month had to cover the entire month, so that was difficult in the beginning. Then they asked us to do some housing because Land of Sky also does some housing work. And so they asked us to go into housing, which we were happy to do. There again, we had to have extra staff to do that. But the pilot allowed for us to pay first month's rent and deposit for someone getting into housing. It allowed us to pay for connection fees for utilities. It also allowed us to pay utilities that were in arrears. So to keep someone in their home when they weren't able to pay the bill. And there was obviously they had to go through counseling, financial counseling, because if they were in arrears, how can we keep this from happening again? So there was a lot of housing opportunity that we had there. Let's go to the next slide, Melissa. So like I said, we were building this transportation network. We were providing technical assistance to those organizations to try to help them figure out how to bill. How do we bill for these services? The referral platform, which was Insecure 360. We also worked with care managers to make sure that all the referrals were appropriate, because they had to be referred from a care manager. So every Medicaid participant that had to go to a care manager to make sure they were eligible for the program, and then they were referred back out to us. And then, of course, we had to bill for those services, and we acted as a pass-through agency. And this is where our strength lies in terms of this particular pilot program, is the fact that a lot of the nonprofit organizations that they relied on in the beginning could not pay out the kind of funds that we could pay and then be reimbursed, because the insurance companies, the Medicaid services were reimbursing us for those services. So if we paid $3,500 to get someone into a new home with their first and last month's rent and their security deposit, we had to wait for that $3,500. We had to bill that to the insurance company and then wait for it to come back to us. We were doing in the third quarter of this year, which would have been, January through March of this past year of FY25. In that third quarter, we did over $600,000 of pass-through funds that were passed through to people that we were waiting on reimbursement for. Now, we weren't waiting on that entire amount at one time. It was coming in, trickling in. But other organizations could not take on that kind of financial burden. Those smaller nonprofits that were working in these areas could not do that. And so that's where we were able to step in as an EDD and say, we have the financial capacity to wait. We're used to waiting because we are doing that with our grant funds, across the board. If we're working with EDA or we're working with DOT, we're used to waiting for those reimbursements. We do the work and then we draw down the money to reimburse ourselves. So we were used to that kind of give and take. And so that was where our strength lied, and that was what we were able to bring to the table for this particular program. Um, I think that's about all. I don't want to take up too much more time, but these are some of the results that we had, and you can get that in a slide later. This is how, the kinds of, we weren't involved in food or interpersonal service, but transportation and housing. We did a lot of that work through our networks and facilitated a lot of that. And, like I said, I've just done a really quick flyover, and I know everybody else has got really great things to talk about in terms of the other domains. So I don't want to take up any more time, but if you have questions or, want to reach out later, I'm more than happy to talk about our very long journey, and where we are currently.
Great. Thanks, Vicky. I appreciate that. And yeah, I think, we in this hour and a half session, we can't go through all the determinants of health, but I think we're covering a few of them. And I appreciate you sharing that story, Vicky. I guess before I move it along to Shaq, I think it would help to understand kind of what's going on, just quickly, what's going on now.
Yeah, so these the federal dollars have been approved for another 5-year pilot, which we hope with, we were really excited about trying to get another 5 years because you really can't tell. It's hard to gain your how effective you're being. Um, we've only been doing this since March of 22, so it's difficult to really um, gauge your effectiveness. Um, so we were approved another 5 years, but the state has to come up with enough money to match. And
Mm,
it's not 100% match or a 50% match. It's a formula that the Center for Medicaid Services requires. The state has yet to do that. So at
mm,
this point, we are on hold in terms of providing any more pilot services um, for Medicaid clients, which has really broken our hearts. We have had to have a reduction in staff because of that. Right now, they're not allowing us to go forward.
mm,
Um, so we're on pause. We're not doing
yeah.
any more of this work right now, but
Mm,
we're really hopeful that the state, they have to pass a budget here pretty quickly, or we're going
mhm.
to, into the
Yes.
shutdown that we all know happens.
Yes.
But hopefully when they pass that budget, that they will include healthy opportunities and we can continue to do pilot services for folks.
That's really helpful. I mean, the results look pretty impressive to me. So hopefully,
Yeah.
fingers crossed.
We are saving, in the 3 years that we did have good data, we had saved over $1,000 per person per year in their medical costs. So I think that's and I
Yeah.
think it's a lot, it says a lot. In just 3 years, we were able to move the needle a little bit on healthcare
Right.
costs.
Oh, yeah. No, that's super impressive. Thanks, Vicky. And I'm gonna pass it along to Shaq Powers. Shaq, do you want to introduce yourself and we can move through your slides?
Yes, ma'am. Thank you,
Thank
Melissa. Thank you
you.
for putting this together for today. And good job on all your work, Vicky. So, my name is Shaq Powers. I am a project manager with Region 9 Economic Development District in Southwest Colorado. So, we serve 5 counties, the Southern Ute Indian Tribe and the Ute Mountain Ute Tribe, and 10 municipalities in Southwest Colorado. And today, I'm going to talk about broadband infrastructure as it relates to the social determinants of health. And so the first thing we're going to do is look at, exactly what are we discussing when we're talking about the social determinants of health. So according to health.gov, social determinants of health are the non-medical conditions in the places where people are born, live, learn, work, play, worship, and age that shape health and quality of life outcomes. Um, so I think we saw on an earlier slide these things as well: economic stability, education, healthcare, uh, neighborhood and built environment, social and community context. And today we use broadband infrastructure for all of those, right? All of our businesses run off the internet, education runs off the internet, healthcare access and quality, the infrastructure has to be built into the neighborhoods, and then of course everybody uses the internet for social and community context these days as well. But on slide number next, moving along, talking about broadband specifically in our region. In 2022, right after we came out of the pandemic, Region 9 commissioned the writing of a broadband roadmap, and that was published in 2023. And this was based on the recommendations of IT directors and people in local government staffs that said, hey, this is really an issue. So what we found out in our counties is basically none of the counties had everybody served, but you can tell looking at those numbers that in our most populated county, which is La Plata, 37% of people lacked 100 megabytes per second, which was at the time considered served. And it just got worse from there. Montezuma County, 42. Dolores County was 76%. And I have those numbers broken down beneath there in numbers of people too. So to put that in perspective, for Montezuma County is a population of about 20,000 people. So you can see about half of the population is underserved or unserved in 2022. So we had a long way to go for making up the digital divide. And this is coming out of COVID, right? When everything was being done remotely all over the rest of the country, you can see that our particular rural region was way behind in the digital divide. So step number one was putting together that broadband roadmap of saying where we were and where we wanted to go. So how I'm going to relate this back particularly to the social determinants of health. September is Suicide Prevention Awareness Month. On September 10th of every year, we observe World Suicide Prevention Day. And the idea throughout the whole month is to raise awareness, reduce stigma, and encourage action. And so I don't know who all's on this call today, but if you or someone you know is in crisis, you can text 988 or chat 988 lifeline.org 24/7 for confidential support. SAMHSA +1 Veterans Crisis Line, just dial 988, then press 1, or you can also text 838-255 for the Veteran Crisis Line. And for today's talk, in 2022, the VA reported an average of 17.6 veteran suicides per day. So keep that number in mind. I think the statistic used to be 22 a day, but it's come down to 17.6. But why that's important on the next slide, one of our member governments is Montezuma County. That's actually where I live, and we have about a 10% veteran population, just over 9%, which is higher than the rest of the state and the rest of the nation. The state of Colorado has between 7 and 8% veteran population, and the United States as a whole averages between 6 and 7% veteran population. But putting that in perspective, Montezuma County is 1/4 in the Four Corners area. So we're the very southwest corner of the state of Colorado. And the nearest VA clinics are in Grand Junction, Colorado, or Albuquerque, New Mexico. Those are both 4 hours away. And if we go to the next slide, please. So for our veteran population, many of them came back from fighting for 20 years in the Middle East, the war on terror, and a lot of them came back with PTSD and other mental and behavioral health and substance abuse problems as a result of what they'd seen. And all the hyperlinks that you see there, that's just showing a problem that these veterans in particular had, and that is that when they needed behavioral health counseling, they could not speak to anybody who did not have a security clearance high enough to hear about the things that they had to talk about, because a lot of the missions they had been on and a lot of what they had carried out had not at that time been declassified yet. Now, obviously, the further we get from the war on terror, the more things become declassified. But that was a big issue for veterans for a long time. And when you're 4 hours from a VA clinic, if you don't have access to online healthcare, then that means you've got to drive those 4 hours. And in Southwest Colorado, that means going over mountain passes in the winter and or going down into another state in Albuquerque. So a lot of road bumps for that if somebody does not have access to the internet so they can talk to a VA counselor with the proper security clearances. Next slide, please. So what we began to do is to work with our neighboring regions, regions 10, 12, and 8, to develop a concept called the Alpine Loop. Now, what you're seeing there, you see 4 cities, Denver, Grand Junction, Durango, which is in our region, and Walsenburg. This is a map of basically the I-70 and I-25 corridor in Colorado, and then everything south and west of those corridors. And we intend to secure leases on dark fiber and or build out fiber to connect those 4 cities. Um, and by putting it into a ring shape, we can make a self-healing so that I don't know how many of you are familiar, but if there's a mudslide in the Glenwood Canyon area, or if there's fires in Southwest Colorado or construction in the Denver area and fiber lines are hit, we can provide self-healing. So on the next slide, it's just another picture of the ring and what that backbone is going to look like. But if that was to interrupt, next slide, please. We will be providing optical capacity throughout this ring that we're creating around the state. So we're using 2 strands of fiber for long haul and then 2 strands of fiber for access. And the way we're able to build out a statewide network with just 4 strands of fiber can be seen on the next slide. We're using a technology called dense wavelength division multiplexing. So all of you listening at home, say that with me, dense wavelength division multiplexing. There's going to be a test on that at the end of this webinar. I don't know that Melissa let you know that in advance. But basically what that means is in the early days of fiber, we were able to send light through tubes of glass using coarse wavelengths. As technology has progressed, we've been able to add more and more wavelengths, and each length, each band of light is like a lane on an interstate. And so we're able to get all these different lanes and different frequencies so that we're sending up to 160 channels of information through one fiber at a time. So we're able to really pack the information in so we can do this whole loop on just 4 strands of fiber. Next slide, please. And by adding edge routers to the system, they are continually sending messages along the fiber so that if there is one of those events that I showed in an earlier slide, such as mudslides or fires or construction that damages the fiber, the routers will pick up the disconnection and send it the other way around the loop. And of course, light moves through glass at a rate of 200,000 miles per second, so the end user should never notice a difference. Next slide, please. So by putting together the Alpine Loop and mapping everything out in a roadmap and being in constant communication with the state, we were able to get funding from our partners at the state to build what we call carrier neutral locations around the area. That's the acronym CNL there. And to get the equipment, which is the optical and routing equipment I just briefly discussed to go in those CNLs, and to build certain middle mile portions. So what you're looking at on this slide is grants that we were able to get from the state of Colorado. But after that, people will probably remember a couple of years ago, plan came out called Capital Projects Funding, CPF. That was a pass through from the NTIA to the states. And on the next slide, because we stayed in constant communication with the state and we kept being the squeaky wheel, these are the awards we were able to get for our area there. So 3 of our counties, Archuleta, La Plata, and Montezuma, as well as the Southern Ute Indian tribe, were able to take home over a third of all of the awards for the entire state of Colorado. So to put that in perspective, the state of Colorado has about 5 million people. Our 5 counties have about 100,000. So we're about 2% of the population of the state, and we took home over a third of the capital project funds from the state of Colorado. So that was a big win for us. And as you can see, that connected several thousand homes. On the next slide, you'll see what we've recently learned from the final proposal that was submitted by the Colorado Broadband Office to the NTIA for BEAD after getting through the benefit of the bargain round. And you can see on this slide for the state of Colorado, funding was proposed for 92 projects, 25 subgrantees, 96,000 locations, $421 million from the feds, $166 million in match from ISPs, and $51 million from the state. The state of Colorado did something unique. They knew we had a lot of areas that were very hard to build. So they put up $51 million to help ISPs match in places that were going to be extremely costly to build. So just over 47,000 of those locations are going to go to satellite. The bulk of them are going to go to Amazon Cooper. Some of them are going to go to SpaceX. 45,000 are going to be fiber locations, and awarded wireless is going to be give or take 2,600. So keeping that in mind, 421 million from the feds and 51 millions from the state. You'll see on the next slide what Region 9 is the state has proposed to NTIA to take home. We're going to get $87.9 million, almost a quarter of everything in the state is going to be distributed to Region 9. And from the state match, we're getting 27.5 million of the 51 million that the state set aside. So we're taking home over half of what the state set aside for match. And we're going to end up having another 9,000 locations served via either satellite, fiber, or wireless. So the takeaways were, number one, we had to identify the problem, but 2, building a plan, and then 3, sticking with that plan and being in constant communication with all of our partners around the region and continually pushing that communication up through the state about our need and having our plans together so that they knew we were ready to take on these projects. And I think the next slide is just asking for questions. And Melissa, I didn't know if you're going to do questions now or if you were going to hold off till the end.
Yeah, I think we'll hold off till the end, but yeah, I'm gonna ask a question though, because I'm just curious, like what kinds of partners you had in this arrangement.
Yeah, thank you for that. So obviously the state of Colorado has been a huge partner, but we also had the IT staff from our local governments on board, as well as, so I hold weekly meetings with our our member governments, so the counties and the municipalities. We meet weekly to check in, talk about what's going on, where we are in the progress of getting things done. And then I hold monthly meetings that include all of our power companies as well as all of our internet service providers so that all of the stakeholders are involved and a part of the process.
Cool. Thanks, Shaq. I appreciate it.
Yes, ma'am.
Okay, yeah, we'll wait till questions to the end. Sorry for sorry for asking my question up front, but I want to make sure we get through all our presentations and then have some discussion. But I want to move us along to Rochelle Howe. Rochelle, do you want to introduce yourself and kind of tell us what you're going to talk about?
Yes, I'm Rochelle Howe. I'm the executive director here for Upper Explorerland Regional Planning Commission. We're what the state of Iowa calls a council of government, and there's 17 of us across the state, and I'm one of those 17. And I cover 5 counties. It's the 5 counties in Northeast Iowa, so we're closer to Minnesota and Wisconsin's capital than I am to my own. So that kind of puts us in a unique perspective for workforce and labor shed issues, as well as childcare issues. Today, I am going to talk about an innovative approach to childcare. It has not solved the issue by any means, but it's given credence and light to it. And as you know, as far as childcare for a social determinant, the ability for parents to earn an income and work can weighs heavily, right, on them with having children. Early childhood education is of the most importance to our children, and then of course quality of childcare. I was no different than many other states that we have what we're calling or have called in the past a childcare desert. And so that needed to be addressed. And some of the barriers within Iowa and the Iowa counties for childcare needs that we have been seeing is low pay, high turnover for staff. Staff are receiving $10 to $13 an hour when they could go and work at Quick Star, a local convenience store, with having benefits starting at $16 an hour. So that's difficult for them to compete. The high cost of childcare for families. We're seeing the average home is supposed to be about 7% of a family's income for childcare, and we're seeing anywhere from 11% to 14%, almost double. We're one of the states that are the most expensive state to raise a child in. And then there's not enough spots for children. There's 2,322 children in Almaquee County, one of the counties that we live in and that we serve, and there's only 574 spots. So you can see that's a big difference. But in the early 2020s, the Postville Child Care Center out of Almaquee County was working with the Iowa Women's Foundation and talking about they were ready to close. They couldn't keep the center open. They couldn't find employees. And so they had rooms that were available if they would have a staff member, but they couldn't find a staff member or keep a staff member to have those children served within the communities. So they started working with the Iowa Women's Foundation, and then the Iowa Women's Foundation began conversations with the Iowa Health and Human Services. And what the Health and Human Service Agency did was to develop some pilot grants for a childcare solution. So in 2023, they developed the application process. It was a 50-50 match. And they selected 2 pilot projects out of the 5 counties I serve. One was Howard, one was Almaquee. We did not assist Howard County. They kind of had their own vision and way of applying and doing the work, and they had some folks they were able to do that. But Almaquee County turned to us, and we helped them apply for the application. As you can kind of see on the screen, the grant writing, working with the different agencies, data collection, outreach engagements, and then served as that knowledge expert. So you can turn the slide if you would. But then once awarded, in the fall of 2023, the group did look at, what is the supply and demand, gathering all this data. What did the providers need? How many providers do we have? Right currently, Elmeke County has lost 56% of their childcare workers and facilities within the past decade, due to pay or due to retirement. So there was this overarching in-home centers that were registered, but those folks were retiring. And so that's quite a culmination to have of, you have some centers that can't find employees, and then you also don't have centers anymore. So we were helping them gather all this data to kind of quantify what the needs were, and then looking at those centers, what are your needs? So you can turn the next page. So we helped during the process with the solutions fund. It began as a wage enhancement fund and kind of turned into a solutions fund. Wage enhancement wasn't maybe the correct term or the popular term to utilize, but we held childcare lunch and learns. We wrote business letters and talked to try. We needed to raise this 50% of the monies. We did go to cities and counties. We did go to businesses and did receive some money, but probably more so monies came in from individual people. I just happened to be at our grocery store one Saturday, and a grandma came up to me and she goes, Are you the one that's working with that childcare solutions? And I said, well, yes, I mean, our agency is. And she's like, I know what the needs are out there. And she wrote me a $6,000 check in the store that day. So it was a high advantage to get my groceries that day. But so there are people that do understand the need and the issue that sits around this childcare desert. We did then write the grant. We were awarded, and we allowed the in-home centers and the in-home registered centers, and then the offsite centers. We allowed them to take the monies and utilize that to how they, we had some meetings with all of those folks, developed a committee, and then allowed them to utilize those funds how they saw fit. In the end, it kind of worked out that they all did the same thing, which I think was of advantage for us to administer the funds, and then to have some sort of continuity within the region. But we did serve 88 staff members out of 4 licensed childcare centers and 11 registered in-home centers. Now, it was a little kittywampus perhaps with the in-home centers, as do they just give the monies to themselves as the provider, or do they put that in some sort of investment? And some did both, or some did one or the other. One in-home child care center built a outside shed for her outside equipment. One put a fence up. So the group met and decided that they would give $5,000 each year into in-home centers, and then they could decide again what they wanted to do with that. And then the centers were they utilized it for increasing existing staff, a bump up on their staff, like $2 to $3 per hour. They were able to hire new staff and then open up those rooms. So it was a bit of retention, but it was also to be able to recruit staff as well. So I'm trying to find my notes here, but they assisted with resulting of this fund resulted in 9 new staff within one county within 1 year. Now we are moving on to years. We've completed one we've completed year 2 and we're completing year 3. The funding is dwindling and the grant is no longer there. They have, HHS has come out with another grant, but they want to pilot other areas. They don't necessarily want to continue to fund an existing one, and that is difficult. Those barriers are still there. I talked to some of our staff and they said, to make sure, I think one of the hard problems for us is we're very rural. And one would say, yes, I'd like to go to a business and say, you hold 5 spots or 10 spots for your staff and make that as part of a benefit for them, for a recruitment benefit for them to work in your business. But there's only onesie twosies in our businesses that need the childcare, so that it doesn't make it as important for those businesses to step up and fund. But we've been, we raised $177,000 in the first year. And of course that's kind of been dwindling a little bit, but yeah, that's kind of where we're at with the fund. It was our way of helping fund our daycare centers, and we're hoping that we can continue that with our continued marketing. We've placed QR codes for folks to learn about the program, how they can give. The coalition still is meeting, and like I said, there's still funds available for next year. They're just a little bit smaller. So I can take any questions as well as the other speakers.
Yeah, no, thank you so much, Rochelle. Yeah, I think it's time for questions. I put some questions up here, but I think if folks have questions for our speakers, we can do that first. So we're a small enough group. I think you can either put them in the chat or you can unmute yourself. I think we can just chat. So feel free. We've heard about a few different things that these 3 are up to. So I'd love to hear how some of you are engaging with the social determinants of health in your own work. So this is that opportunity. I'm going to stop sharing so I can see you all for a sec. There we go. So do we have any questions? Oops. Question about this recording will be shared, as will all the slides. Yeah, anybody want to share about their kind of how they're engaging in the social determinants of health, or any questions for 3 speakers? Yeah, go ahead, Michelle. I'm not hearing you.
Sorry, can you hear me now?
There we go. Yes.
Okay. Hi, I'm Michelle from Hawaii County. I had a question for Rochelle. The early childhood is also a thing here, obviously. But I've just been noticing that we continue to look at childcare centers, and I understand, like, you need less staff, right? And you can serve more children. But I'm just wondering if you guys ever explored looking at maybe incentivizing like nannies. I know it's kind of like one-on-one, one person that serves in a household, but that also eliminates the need for, I guess, upgrading a space to be compliant with different laws and all of that. And I'm not the childcare expert. I do business development.
Yeah,
but
yeah.
yeah.
Isn't it funny? None of us are the childcare experts, but here we are, right? I bet you some folks weren't the broadband, but we're doing that too.
Yeah.
I have not, but I'm going to write that down. Thank you. You're actually giving me the tip. But our childcare centers in Iowa, anyway, I'm assuming it's a national thing that you can only serve, you have to have 1 adult to 6 babies or whatever the ratio is. So, and then the space for these centers, they dictate what amount of space is given too. So that wouldn't be true on the nanny end of it, but that would be interesting. Now I know that they did look at some, and then our governor diminished our took the funding away from our Head Start program and opened that back up for RFQ and RFP. So that's been a problem too. But I know one of our schools applied for those funds to capture that right back into the school. But yeah, it's a serious issue. I don't know if I answered your question, but we have not looked at nanny, but that's great. That's a good thought.
Yeah, I was just thinking too, because like there's not a lot of startup funding for businesses anyway, right? And so incentivizing that, like it kind of helps with the sustainability of it, because then as a business owner,
Yeah.
you kind of
We
figure that out.
we
But yeah.
we do have a revolving loan fund, and I don't know how it was started, probably back in the 80s, but it is specifically for daycares, whether they're private, they can be private or nonprofit, and they can apply for funding. And I think it's up to $10,000, but it is a low interest rate loan. And these particular businesses are right at the edge where getting a loan might not even be of an advantage to them. So, but we do have that, and we do utilize those funds for in-home centers already.
That's awesome. Thank you so much for answering my question.
Yeah.
Yeah, thank you. And I was aware of there's Coastal Enterprises in Maine had a really amazing childcare business kind of incubator lab. And I'm pretty sure they got funding to roll it out nationwide, although I'll have to check on that. But yeah, this is an interesting phenomenon. But I think Katie was asking about budget changes. I think that was probably about the Healthy Opportunities Project. And I think we already kind of talked about that. Well, we talked about the state level. I guess, Vicky, in terms of budget changes at the federal level, do you see any? Are the federal changes kind of dribbling down to the state level? Is that kind of what's happening, or? Thank you, Andrew.
Well, for this particular project, the Center for Medicaid Services had already approved the 5-year renewal on the 5-year waiver prior to administration change. And so we were really excited, that had happened. And so for this particular program, at the federal level, we're gold, which I'm kind of surprised at. But it's the state level now that we're battling. Now that's not true across the board with other things that we're doing in terms of federal changes, but for this particular program, Medicaid services seems to be a sacred cow, kind of they're not going to touch, and so we were glad about that, but
Yeah.
we're still facing those challenges on the state level.
State level. Gotcha. Thank you for that. Andrew put the link to the Child Care Business Lab in here in case anybody's interested. I think I'm pretty impressed with that program so far. And then Mike says, we completed a student survey at a local technical college. Why did every student miss class? The result was interesting. 50% missed class because of transportation, 50% missed class because of childcare. In my opinion, this is an economic impact need for future workforce. Absolutely. Yeah. Thank you for sharing that, Mike. I think, this is an issue that really touches so many things, and there are so many components. I mean, we're talking about transportation, housing, childcare, and broadband here, but there's more, right? We haven't talked about food security or some of the other pieces like the neighborhood kinds of issues and the social kind of loneliness issues that, the epidemic of loneliness and all of these things. Yeah, thank you. Yeah, if anybody else has questions they want to ask, I actually want to ask Shaq. I'm curious, you mentioned the connection to veterans and suicide. Do some of the partners that you've been working with, are there additional issues that people are really focused on broadband because of other particular issues, or is everybody focused on that right now?
No, that's one that's highly health related, and especially
Yeah.
with it being the
Oops.
I think I lost my camera for a second
There we
there.
go. You're back.
Sorry, I'm back. But no, one of our more remote towns, the town of Silverton, there's just one path of fiber in and out. So every time something happens, none of the businesses can take transactions. We had them go down for 6 hours a couple of years ago. Just a year ago, our town on the far east, Pagosa Springs, there was a fiber cut between the town of Durango and the town of Pagosa Springs, and they lost everything: cell phone, internet, 911 coverage for 12 hours. So, I mean, everything's literally affected. When you're a tourist destination and you
Yes.
can't take a credit card, that's really hard on your businesses. And, how many people are trying to turn in assignments online, and there's a lot that goes on. One of our towns, Rico, had 117 outages in 2 years.
Oh, wow.
So we've really got to get this redundant ring built and get
Yes.
fiber to people's homes.
No, that's really helpful. I mean, certainly it's really connected to telehealth that I know more and more people are using in education, maybe not as much as it was during the pandemic, but still using a lot of broadband for our educational opportunities. Great. Well, yeah, other questions or any sharing? I did have a slide. I did have a slide just asking how you are or how would you like to be addressing the social determinants of health in your region, or what kinds of challenges are most relevant to different regions that are represented on our in our audience today. Does anybody feel like sharing? I'm not going to make you. I just thought I'd see if people wanted to share what's going on in their own regions. We're a small enough group to just chat. Rochelle, are there other, I mean, we talked about childcare today. Are there other kind of social determinants of health areas that Upper Explorerland is
Yeah.
particularly interested in?
Yeah, we also have been involved with broadband, um,
Mm-hmm.
writing the grants, working with the the companies, the entities that we need to build those out. Um,
Mm-hmm.
a lot of our rural electric co-ops have been getting into fiber builds, and so that's who our partners have become. The state of Iowa did do a good job of putting some broadband grants together, and we received, like, I've written for about $28 million. So two of our five counties are pretty well built.
Hmm.
So that's a plus. But another avenue that we've been looking at is food security. We were part of the Wellmark program and developed Northeast Iowa Food and Fitness, and then
Mm-hmm.
looked at local foods and what is local foods, and being able to transport local foods, opening up, expanding the local food businesses, and then expanding those businesses outlets for their product. And so we've had quite a few businesses over the past decade open up with milk into bulk milk into butter, cheese, cottage cheese, sour cream, ice cream. And I think we've had three different family owned farms open up dairy for that, for the products of that. And then also just expanding our, well, the only thing that we could feed ourselves with in Iowa was raspberries and sweet corn. So we've expanded ourselves with that, with a lot of farmers markets, a lot of roadside stands, those types of things. And then we also looked at fitness, and like our agency, I think if you've sat in on a session that I held with workforce fitness, I believe in that. I believe that our staff are healthier, they're more productive, they miss less work if they have an opportunity to recreate while at work. And so we did put together a program for that. But also we did BMIs within the school districts, and that was
Hmm.
quite outstanding. Um, there's some graphs out there if you look at the nation, and it's like, well, your BMI was at 5%, and then it went to 10%, and then it went to 15, and now every decade we have had to add to that, um, increasing that due to childhood obesity. And
Yep.
so that was a really interesting getting. We did work with our community healthcare offices, our county offices, and did some programming around that. We do touch on mental health. Um, uh, we work with our endowments a lot, our to create endowments and to work on that philanthropic work. So we work with our regional we have kind of parent companies endowments that our county foundations are through, and doing some work around mental health on that level as well. So I mean, like the gal asked, we're not experts in any of this stuff, but it seems like kind of like school teachers. My sister's a school teacher, and so I can kind of see some of the things that they're drawn into with education that, wow, why are you involved with this person's, home life or whatever? I mean, she's like, because it all revolves around the best educational opportunities we can give our kids is if they have a good home life. And that's kind of how I feel that we are kind of getting into some of the realms that maybe we shouldn't, or maybe we didn't need to decades ago, but now we need to.
Right.
Yeah.
Thank No, that's really helpful. I mean, and I guess that's why I wanted to talk about this topic, because I think it is connected. I mean, it's connected to so many things, right? Just the things we've talked about on the call today, even just the childcare, housing, transportation, broadband are all connected not only to people's lives, but to economic development and a lot of the things that EDDs are already doing, right? And so, yeah, I really appreciate that. Okay, well, I don't want to belabor this, but if there aren't any more questions, if there are, please feel free to unmute yourself. I'm gonna kind of just share a last few slides, but this is the original, the kind of comprehensive site for all things WealthWorks, which I really think WealthWorks is very connected to the social determinants of health, which is why I've been kind of interested in it. This is the NATO wealth creation website for all things around EDDs and wealth creation. This is something I don't have a registration link yet, but we are going to have another wealth creation summit next spring in Bend, Oregon. I'm really excited about it. So keep your eyes open for that. And yeah, anyway, I really appreciate you all joining us today. Again, this is through the Economic Development District Community of Practice. You can find all sorts of amazing resources at that website, including the piece behind this topic. There's a piece on the social determinants of health, along with all sorts of other topics that you can imagine. But if there are things that we haven't talked about or we haven't researched, and there's a topic that you want to learn more about, please reach out and let us know. And I'm going to please, if you don't mind doing the survey that comes up at the end of this, it just helps us to know how we're doing and what else we can be doing and what other topics you might want to learn about. I want to thank Vicky and Shaq and Rochelle so much. I think it was so interesting to hear about all of these different components of the social determinants of health. I feel like we could do multiple webinars on and talk about even more, because we just kind of scratched the surface of these kind of four areas, but there are so many areas that are connected to this, including like civic infrastructure and all kinds of, and building social capital in different ways. So I may have a part two, and for now, I really appreciate you three presenting for us today, and thank you all for being here. And I hope you all have an amazing day. And if you want to reach, NATO News, I should say that too. If you aren't subscribed to NATO News, it's the It's the way to find out about all things that are going on at NATO, including the community of practice. So sign up, and this is me. I'm happy to chat anytime, or if you have ideas or want to share something cool that you're doing, please reach out. So anyway, have a great rest of your day. Thank you all again, and thank you.